I'm pleased to be joined by Secretary Nate Smith, as Dr. Jose Romero is here as well, and Director A.J. Gary was on the line shortly ago, and he informed me that we have received 50,000 additional N95 masks based upon our state procurement efforts, and we've received over 10,000 N95 masks also from FEMA. So I don't mention our PPE that much, but that goes to show that it continues to come into the state of Arkansas, and we continue that effort. This morning I had a conference call with various governors, as well as with the Vice President and the other members of the coronavirus task force. And that was an instructive call. We talked about ways that we can expand testing to hot spots, but across the nation. And we did talk about hot spots from Texas and also Arizona. Then we also talked about behavior, and a number of the governors went through what has changed in behavior, it seems, over perhaps the last couple of weeks, which has caused a great deal of concern about compliance with social distancing orders, and whether people have just got pent up and wants to get out, and they've lost some of their concentration on this. But we talked about ways that you can enhance everyone's compliance with what is common sense orders that really should be well understood by the public, because there's been so much publicity on the importance of wearing a mask, of social distancing. We require that here in state government, where if you can't social distance, you have to wear a mask or a face covering, and those are just common sense requirements that we need to have in place. Whenever I look at our businesses, and I had a message from a businessman and just said, would you please remind everybody that our livelihood depends upon the customers really doing the right thing, and that is protecting themselves and protecting others, and not putting the business in a difficult position. And so that's really what we ask everyone, is that as we get back to business, as we grow our economy, as we support our local businesses, we have to be smart about it to avoid other consequences that you're seeing crack down in some other states. And so that would be my message today, is shop, wear a mask, support your local businesses by wearing a face covering. And now let's go to the cases, and this is the first in 3 days since last Friday, and each day we've seen over the weekend 2 declines in our case reports of new cases. And so let me give you today's report. Yesterday we had 19,818 cases. We have an additional 439, which, as you can see, is a decline from the 2 previous days. Total case now is 20,257. So yes, we've reached the 20,000 mark in cumulative cases. In terms of hospitalizations, we had an additional 7 hospitalized, which brings us to 300. In terms of deaths, we have 1 additional death. That brings us to 265. Of the 439 new cases in Arkansas, Washington County had 92. Pulaski County had 56. Benton County had 48. Sevier County 31. And Sebastian County 22. The remainder of the counties were less than 20. So here again, the same concentration in really 5 counties that we see in Arkansas, and the rest under 20 in terms of their cases. If we go to the graphs, you can see our first graph, as we always do, is the number of new cases in Arkansas each day from the very beginning, March 11, going all the way through the last 24 hours. And if you go to the next one, you can see the 7-day rolling average. And here again, you can see the dip down. It flattened and it's dipping down because the last 1, 2, 3, 4, 5 days, actually, you've had a decline in the number of new cases, even though the 3 of them were fairly close there, but it has been a decline for the last 5 days. The question mark for Arkansas is whether we're going to be able to keep up that good work and see a consistent decline, or whether there's going to be a variation from that. In terms of the number of hospitalized, we still see that reaching the 300 mark, and hopefully as we see the new cases on the decline, we'll see some progress in the hospitalizations. And then you'll see the number of active cases in Arkansas that's flattened somewhat, and if we can have more go home from the and recover from this, then we'll see that number go down. And then the 7-day rolling average of new COVID cases in Arkansas by region. This is the multicolored chart, but you can see the trend lines, which is important. And of course, the most important trend line in terms of the largest number of cases is Northwest, and Northwest is in the orange. And you see the significant growth in cases with the beginning of the decline in new cases each day. If you go to the Northeast, which is the blue, you can see a little dip down. The red, which is the Southwest, is fairly level. And then the Central is the yellow, and that's actually had a little bit of an upward trend, but flat right now. And then if you go to the next one, we'll go to our testing results, and here again you can see the positivity rate remaining fairly constant, not as low as we'd like it to be. We'd like to get it back down under the 5% level, but we're well below the 10% level, which has remained constant since day one. You can see the trend line, and the next one actually is the number of tests that we've done for the month of June, and it's not over with yet. You can see where we've done 160,000 tests here in Arkansas over the month of June. And this is something, and now we're going to go back in history for a moment. This is an April slide. This is an April slide that was presented in here that showed the test on a per capita basis by different states. And so this is April of 2020. Where does Arkansas rank in per capita testing? And in April, you can see that we are in the lower tier. The yellow there, where Arkansas, and you can see that Louisiana is the height. Of course, they had such a peak of cases there. They obviously expanded their testing. Tennessee, Mississippi, Florida, and on down to Arkansas. And then if you go to May, the next one, you'll see that Arkansas is just about the same position. Actually, I think we dropped one, or really tied with Alabama. And the two top states, of course, remain Louisiana, Tennessee, but Arkansas still is in the bottom tier. And then if you go to June, let's look at where we are in comparison with the other states. And here you still have Louisiana and Tennessee as the top two states in per capita testing, but Arkansas has moved to third among Florida, Georgia, Mississippi, Oklahoma, Kentucky, South Carolina, Alabama, Texas, Missouri, and we did go ahead and add Kansas in there, as you can see, as to where their testing is on a per capita basis. This is simply to say we've made progress, we've got more to do. We'd like to continue to increase our testing, but it is a good success story that we've been able to expand testing to that level, which has given us, one, new cases, but also a very clear idea as to where we need to do our contact tracing and isolation. Dr. Smith.